What is going on with gluten? Should we all be on gluten-free diet? I'm Dr. Maria Azizian, welcome back, and today we will be diving into the basics of gluten and wheat-related medical conditions. We will answer questions as to who is susceptible to this disease, at what age, and how these conditions manifest. But first things first, what is gluten? Gluten is a family of proteins found in grains like wheat, barley, and rye. Gluten is actually composed of two main groups of protein. Gliadins is one group, and what they do, they make dough extend and add viscosity to it. It's very important for the texture of baked goods. The other group is called glutenins. Glutenins are proteins that provide strength and elasticity of dough. They are responsible for dough's ability to retain gas, which is important for rising and structure of bread and other baked products, of course. So what are the foods that contain gluten? Of course, everybody knows about bread and baked goods, muffins, croissants, etc. Pasta is one of the very commonly used food that has gluten. They are gluten-free pastas that made from, for example, cauliflower. Cereal is a staple for many people in the morning, contains gluten. Snack foods such as pretzels and crackers, and many more. Beer, a lot of people don't know, but most beer are made from barley that contains gluten. So beer is not a gluten-free food, unfortunately. Sauces and condiments such as soy sauce, marinades, salad dressings, some gravies. Gluten is very often a secret ingredient in those condiments. Processed meats such as sausages, hot dogs, and deli meats. And also canned soups and broths. What happens, wheat actually with gluten in it, of course, is used as a thickener for canned soups and broths. So can we use the words gluten and wheat interchangeably? Is it the same thing if you're allergic to gluten or sensitive to gluten, you're allergic or sensitive to wheat? Well, let's look at wheat first. What is wheat made of? In addition to gluten, actually wheat contains other proteins such as albumins, globulins, and proteases. Protein content of wheat, of specific wheat, actually depends on environmental factors during its growth. So gluten is only one protein of wheat. So what does it mean in terms of symptoms? What it means that one could be allergic to wheat without being allergic to gluten. That's possible. That's a very important distinction that sometimes is hard to make clinically. So today we are focusing on gluten specifically, which, as we just talked, is only one protein of wheat. And we will talk about celiac disease, which is also called a celiac sprue or gluten-sensitive enteropathy, not used as much anymore. Most importantly, celiac disease is autoimmune disorder that affects small intestine, and it only acts up if one eats food containing gluten. Gliadin, a protein in gluten that we discussed, is the main culprit in causing symptoms in celiac disease. And what does it do? It causes inflammation of intestinal mucosa, resulting in malabsorption, malnutrition, maldigestion. So all of these words starting with mal means bad thing. So we will come more and we'll talk more about symptoms of celiac disease, but let's talk a little bit about its genetics. It is very interesting that 1 in 35 people have genes for celiac disease, but only 1 in 105 will develop symptoms. Those are very important numbers because they show us that most people who have genes for celiac disease will not develop gluten-related symptoms. So there are 2 genes responsible for celiac disease. They are HLA-DQ2 and DQ8. The main question is actually what turns them on? Why do they stay dormant in some people and turn on in others? According to Dr. Fasano, who is one of pioneers in gluten-related disease research, it takes 3 factors for celiac disease to manifest, to happen, to occur. The first factor, some kind of trigger is required. What are the triggers? What could be a trigger for development of celiac disease? Those triggers could be infection, trauma, surgery, stress, changes in gut microbiome, modern hybridized wheat, increased and early wheat consumption, increased use of chemicals and pesticides. All of these things, and probably this list is not complete really, could be triggers. The next factor that is needed is presence of genes for celiac disease, as we've discussed. There are 2 genes. And the third factor is leaky gut. Leaky gut has been implicated in many medical conditions, diseases, and celiac disease is just one of them. So 3 factors are required for celiac disease symptoms to manifest. So what are those symptoms? There are 2 types of symptoms. There are GI and non-GI symptoms. So GI symptoms, for example, we can have somebody, a 35-year-old female with abdominal pain, bloating, diarrhea, constipation, vomiting, weight loss of 6 months. And this may have been triggered, for example, a long bout with flu. And you guessed it, flu is the trigger. Here's another scenario with now non-GI symptoms. 55-year-old male with bone and joint pain, migraines, depression of 10 years, reports no abdominal pain, no diarrhea, no constipation, no GI complaints at all. So, and in addition, there are other non-GI symptoms that one could have, and some of them present a true diagnostic challenge, and those symptoms are, for example, anemia, fatigue, arthritis, osteoporosis, depression, anxiety, seizures, missed menstrual periods, infertility, even recurrent miscarriage, dermatitis, other skin problems, canker sores, the list goes on. In children, celiac disease actually can lead in delayed growth and puberty and short stature and some dental issues. The next topic is, how is celiac disease diagnosed? So, well, the first step in diagnosing celiac disease is usually a blood test to check for the presence of antibodies. The most common tests are TTG, IgA, so those are tissue transglutaminase in immunoglobulin A, and this is a primary test that's used for screening. It measures the level of TTG antibodies. However, in addition to that test, there are some other tests because it's not always straightforward. Some of those tests are EMA. Also, one could measure total serum IgA levels as well. There's also genetic testing. While it is not diagnostic on its own, genetic testing can be used to rule out celiac disease because almost all people with celiac disease have one of 2 genetic markers, DQ2 or DQ8, as we discussed earlier. So, and if you don't have neither one of them, then it's very unlikely that you have celiac disease. Another way to establish diagnosis is a biopsy. And a biopsy of small intestine is done endoscopically. A small piece of intestine is taken and then analyzed by the pathologist for damaged intestinal mucosa, because that's really how celiac disease manifests. So that's characteristic of celiac disease. So next is, most important, what is the treatment for celiac disease? At this stage, there is no treatment per se for celiac disease. The only way to eradicate symptoms is to avoid gluten. There is a lot of research in this area, and some of it is very encouraging. For example, some studies showed that probiotics that contain lactobacillus can assist in breakdown of gluten. That's actually quite a big deal in the world of gluten research. So in summary, celiac disease happens in individuals with specific genes for celiac disease. It can happen at any time, at any age. Some trigger is required for those genes to be turned on, and what is considered trigger could vary, but even a simple life stress, which is never simple, but a life stress could be a trigger for celiac disease. So, and that's a celiac disease in a nutshell. Thank you very much for listening. Until next time.